Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Ali Al-Majhad from Alor Clinics. It is my pleasure today to welcome you in doing a very quick small workshop just to show you an example of using different products, injecting it in different areas. The first case we have is injecting the hands using radius, rejuvenation for the hands. We will be using one syringe for both hands. In the second case, we will be doing rejuvenation for the lips area. We will talk about the different using of different products for each area. We will talk about the varies of the different techniques in injecting each area. And also we will go quickly through the anatomy of the area to be injected. We will be using today the radius for the hands, and we will be using Pelotero product. We'll talk about each different of the product later on to inject the lips. Thank you. Before injecting any patient, is the most important 5 points always to remember is, first of all, knowing the anatomy of the face very well. Second, selecting the right patient. Third, selecting the right product. And fourth, knowing how to deal with your complication. And the fifth and the most important one is being an artist in knowing how to inject your technique in injecting that patient. Of course, we have different product to be used in different areas. Just talking quickly about injecting, for example, the hands is the best product to be used as the radius for rejuvenation of the hand. Also, radius can be used in the deep soft tissue augmentation like cheeks, sometimes the nasolabial fold, the jaw lines, and the chin. If you have a patient to be inject, for example, tear trough, Pelotero Soft is the best product to use for the tear trough. It has 20 milligram of hyaluronic acid in each cc. For the lips, usually my favorite product to be used for the lips is either going for the Pelotero Intense or Pelotero Balance, depends on how much volumizing or rejuvenation you need for the lips. Also, Intense is a perfect product to be used for the nasolabial fold. Pelotero Balance is good for those patients who have a good voluming of the lips, but they need more rejuvenation, more hydration, and contouring. In the soft tissue augmentation using hyaluronic acid, we have Pelotero Volume for the chin, cheeks, and the jawline, and sometimes even for the nasolabial fold. It also has a concentration of 26 milligram of hyaluronic acid in each cc. Of course, we always remember is using the soft tissue augmentation, always combining it with using botulinum toxin. We have Xeomin here. Is always I use it with the patients if they need to be relieving the wrinkles. What we have in the workshop today, we will see it later. We'll be using it for Pelotero to inject hyaluronic acid for the lips, and we'll use radius to inject the hands. Okay, Bismillah, and we have this beautiful lady here. She's not exactly for what most patients, they are exactly looking for the hand filler. She has quite full hands, but in the same time, a little bit of rejuvenation for the hand using radius. It will make the hands look more beautiful, especially at the areas that she has a little bit of wasting. The dilution of the radius, when we're using the radius product, the syringe, it comes with 1.5 ml. And the standard dilution for using the radius for the hand indication, usually diluting 0.5 of lidocaine, 1% of lidocaine, together with 1 cc of normal saline. This will be total of 1.5 dilution. With the 1.5 of the product of radius, it will be total of a 3 ml using for both hands. In the average rejuvenation hand indication, usually we go with the standard dilution and using one syringe, dividing it in both hands, and then we reassess the patient after some time, and we see if she needs more filling for the hands, more radius in the second session or not. The technique, usually it varies from physician from doctor to another doctor. Usually it's easy. All what you're looking for in the indication or the technique using the radius for the hands is less pain, less swelling, and a good result. The plate that we are injecting here is a subcutaneous. We will be using a cannula, blunt cannula. This is a 25 cc, 25 gauge blunt cannula, almost 2.5 or 2-inch length, which can reach most of the areas. In the dilution, we use the connector in diluting the radius with the 1.5 dilution, which is 0.5 lidocaine and 1 normal saline, 1 cc of normal saline, mixing it together in both, and then connecting it with the blunt cannula, and it will be ready to be injected. We use usually our point of entry from the area that we think that we will reach most of the areas need to be injected. You can use your point of entry distally and then inject with go with the blunt cannula proximally, or you can go to the opposite, which is more convenient for most of the patient. Easily because we are injecting in the subcutaneous, easily you can choose your point of entry in the area where there is no blood vessels, and easily you can, visibly you can see the blood vessels. You just inject in the subcutaneous plate and then insert the cannula slowly. As we can see here, no need for too much trauma. It's just you go a little bit slowly with the blunt cannula and ask the patient, we can a little bit inject because the lidocaine will kick in, so you can inject while you are actually going with the blunt cannula into the area to be injected, starting from fanning technique is fine as well, as long as you can look at the tip of your cannula and know exactly where you're injecting. The pain usually is minimum. A little bit of discomfort. Patient expectation after the procedure, a little bit of swelling, maybe for 24 hours or 48 maximum. Bruises is rare because the blunt cannula is pushing the blood vessel away, as you can see from here. It's just distributing, the whole idea is distributing the product of the radius into different sides of the hands. We're not allowed to inject over the joints. Probably need to avoid injecting over the joints and only at the dorsum of the hands. You can look at the tip of the cannula, at the plate here, injecting, and also on the side. So this is convenient, less pain, and just easy procedure to do. Once you inject all your product, you applied a little bit of pressure. Ideally, you want to wait for the product to take the temperature of the body. The temperature of the body varies in the hands, varies between 30 to 35 Celsius. And the product at the room temperature will be around 20s. So you want either the patient to wait or to put her hands in her body, or just to hold it and to wait for the body temperature to take with the product. It will make it much easier to massage. You can start with the other hand and then come back to the hand that you injected first. So the product, once it takes the body temperature, you can massage it easily and it will show good result. If we show here the instructions that usually give the patient is frequent massaging in the first 3 days in a circular way in the dorsum of the hands, 3 to 4 times a day, each time almost around 5 minutes. Gentle massaging, it will help to distribute the product more. And as we know, the radius is also going to stimulate the normal collagen process and also will enhance the vascular supply of the hands. So we're expecting more hydration, better skin quality, and also better volumizing for the hands. It's an easy procedure with very high satisfaction rate from the patient. And comparing both hands, ممكن تقارني بيدينك الثنتين، تحط اليد الثانية مع هذه. And if you compare it to both hands, you can already see the difference, and you do like that, the difference in each hand. Because her hand's already full, so you don't appreciate the difference immediately, but the patient will come to you later telling you that it is better hydration and also better skin quality, and it looks much younger hands. Okay, now we will inject the other hand. using a little bit of different technique, using the sharp needle instead of the cannula, just to show that actually this procedure, whether you're doing it with a sharp needle or with a blunt cannula, it is both easy and accessible technique to do. The pain and the risk of bruises will be a little bit higher using the sharp needle compared to the cannula, but at the end of the day, the outcome is the same. It depends on your comfort. Using the sharp needle, you go directly to the areas that you want to inject. Maybe you can start distally from the distal part of the hand, going proximally, like here, bismillah, and then you inject a little bit, also subcutaneously. Also you go to this part. Distributing small part of boluses in each part goes. As you can see, the only difference is the risk of bruises and swelling with the needle compared to the sharp cannula. The only product that it is officially labeled to be used for hand rejuvenation is Radius, although there are many other products that have been used lately for the hands, but this is the officially approved product to use for the hands. As we can see, we have injected, and it is also easy and more, it's easy technique to do, but it's just a little bit more risk of bruises to the blood vessel. Prior to the procedure, we only applied numbing cream over the dorsum of the hands for 45 minutes to give the patient more comfort during the procedure. Also, we ask the patient to massage it frequently in the following 2-3 days, and it will be fine. I always advise to reassess the patient into 2-3 weeks and to see it, and then maybe if the patient needs more, you can inject more. But in this patient, I think it's enough. And as we can see, with 1 syringe of Radius, we rejuvenated both hands with a very good result. The patients between the hands, she was telling me, after we did the first hand, she was telling me how much she appreciated the difference already, which is very good because the patient satisfaction can be very high immediately after the procedure. Now we will talk quickly about, we will do here the procedure for lip rejuvenation, but I would just need to do a quick reminding of what we talked about, the facial anatomy, the anatomy of the face. Just quickly about the vascular, because here when you are injecting hyaluronic acid or when doing subcutaneous soft tissue augmentation, the most importantly what we care about is the vascular supply. So if we go revise quickly, what we talk about is we have the branching of external carotid and internal carotid to the face. We know that the facial arteries, all of them, they are actually extending from the external carotid, except the ophthalmic branch, which come from the internal carotid. So we have the external carotid artery giving us from the notch over here, branching from, giving us 3 branch, which is the maxillary artery, facial artery, which change into angular artery, and we have the superficial temporal artery. And for the internal carotid branch is only supplying the ophthalmic branch, which is giving the supply for the dorsum part of the nose, the forehead of the face, and also the ophthalmic artery. When we're doing rejuvenation for the lips, mostly what we care about is the angular artery, to avoid any kind of intravascular occlusion or compromisation. We have the angular artery, and we have the superior labial and inferior labial arteries. Basically, what are most commonly or most popular technique injection of the lips is using the sharp needle. So using the sharp needle, as long as you know your anatomy, just to avoid any vascular compromisation, and we will talk about the signs of that later on. Choosing the product of hyaluronic acid is the most important. Usually the most popular or the most common product being used for the lips is either Politero Balance or Politero Intense. And the Politero Intense is more when you are looking for more volumizing of the lips, because the concentration is 25 milligram of hyaluronic acid in each cc, and it comes as 1 ml syringe. For the Boletiero balance, it's 22.5 milligram per cc, and it is usually for less volumizing and more rejuvenation. In this case, which is, I think, this is the most popular cases that we see in the clinic, which is mediumly volumizing, nice voluming of the lips, but she needs more of the rejuvenation and more of younger and little bit of volumizing of the lips. So we will use here Boletiero balance. If we're looking for more volumizing, I would use Boletiero intense. We will use now Boletiero balance. You have two ways of approach. Either you can start with the lower lip or you can start with the upper lip. It depends on your way and how much you can control your product. You always want the lower lip to be a little bit bigger, almost 2/3 the voluming of the upper lip. So in that case, I will start with the upper lip. I'll inject a little bit, and then we can focus or give more voluming to the lower lip. You can use only 2 points of injection, approaching from the skin to the mucosa. You can inject a little bit superficially using the balance, and then another point of injection to the center of the upper lip, almost 0.05 in each one. So I have used 0.1. The same thing, we do it to the other side. .05 and another 0.05 in the upper part. We use only 0.2 so far for the upper lip, and you don't want much more than that, because you want always the lower lip to be more enhanced and a bigger little bit than the upper lip. Our target here to do more rejuvenation. As we can see, is minimum bleeding. Also, doing the lower lip, approaching from the skin at exactly the vermilion line. .1 and another 0.1, almost double the amount that I've injected in the upper lip. So 2 points of injection in the upper lip was 0.05, 0.05, and here we do 2 points of injection, 0.1 and 0.1. Again, approaching from the skin to the mucosa, injecting 0.1, another 0.1 here. So as we can see, not avoiding to insert the sharp needle from the mucosa directly, the advantage of that is giving us less bleeding and less bruises and less swelling. You do just gentle massaging just to make sure that the product has been blended in with the skin, and you can advise the patient to do a little bit of massaging at home as well. Always reassess after you finish injecting just to double check there is no asymmetry. Close your lips. She might need a little bit here, and that's it. As we can see here, we do injecting using Boletiero balance. The advantage of that is rejuvenation, hydration, and stretching of the lips, and also a little bit of volumizing. And as we can see, with this approach, we don't have much of bleeding and there is no much of swelling. That offers the patient less downtime and more comfortable and more ease doing the procedure. The only post-procedure instruction you give to the patient is gentle massaging at home and to revisit and to see the patient again in a couple of weeks. Was there any pain? Or a little bit? So we use numbing cream before the procedure also for 45 minutes, which helped the patient to give an ease.